Welcome back to the broadcast, and it's now time that we expand some more on health issues right here in the country as we take a look at the situation on matters COVID-19, and we have a specialist who joins me this morning to expand some more on the same. Dr. Samuel Omolo, he's a disease diagnostic expert territory and manager antibiotic for Africa. Good morning, Dr.
Good morning, how are you?
I'm good. Thank you so much for finding time for us this morning.
It's a great pleasure hosting me.
Good.
And, thank you.
All right. So Russia and the World Health Organization is currently having a conversation that revolves around, the process of pre-qualification for its newly approved COVID-19 vaccine. And according to World Health Organization, says yes, some good hope, but it is important that we do not rush into this. Sigh of hope, if you'd weigh in on the same.
Thank you very much, and that's a good question. For the vaccine and what we have currently in the world, first of all, I have to underscore the fact that this is an unprecedented global nightmare. It's been seen before. It's a combination of spectacular, highly transmitting virus within the community. I say it's a truly historic global nightmare, and also quite pervasive and transmitting virus at a high speed, dated back to the 1918 Spanish flu outbreak. So a vaccine would be a timely intervention, but without a rush. We are not yet sure if Russia gets a good quality vaccine. That's a bingo for the world. It's a good breakthrough. But there's so many that we've seen in the past. The Chinese also developed their own vaccine recently. But what I know scientifically from the Russian vaccine is just an attenuated vector. A vector is any medium that you can use to transport a vaccine into the human system. So they're using a viral vector to transport RNA into human system, so to provoke an immune reaction. But I would not say much. We are only 6 months into the pandemic, and we want to rush into conclusions about having true vaccine or not, because you look at the cohort and the number of people, they've just done like a few hundreds, but you'd want to have thousands within your cohort of study exposed to the virus, from Africans, Europeans, and to Asians, to get a clear picture of a true vaccine.
All right, we can only hope for the best as it stands at this point, when the world has more than 20 million cases or the death that have been caused by COVID-19, 700 worldwide. That's crippling the world's economy in a huge way. So we hope that this is going to be addressed, and if addressed and indeed brings hope, then it will be the right direction to take. But that aside, there have been reports of after effects, in as much as we celebrate the fact that there are people who have recovered from COVID-19. We've registered high numbers of recoveries, almost half of the numbers of the people that have been infected since the first time or the first case was recorded right here in the country. It looks like we're being told that after you have recovered from COVID-19, then the patients are likely to have, the after effects of the same, in the sense that they will have also difficulties. I mean, they will have their heart and their kidneys damaged and all that. What do you say about this report? And moving forward, is there a way that we can avoid such scenarios from occurring?
Thank you very much for that wonderful question. So as I've mentioned again and again, that we are only 6 months into the pandemic.
Yeah.
We are learning a lot. It's still a ponderous box. And I can only compare it to flying a plane and making it at the same time. So you are learning as you make your plane, and also you're flying it and repairing at the same time. So regarding recoveries, we've seen quite a number of recoveries this week, and that's good news to the country and the world. But before you go into that, there are scientific facts that never change. So have what we call scientific unknowns, which health experts have to really deal with, which the first one would be if we have recoveries, what's the full extent of the immune response? Yeah, the natural immune response that's not induced. Yeah, then the long-term chronic effects of this disease after recovery, no one knows because we're only 6 months into it. The third important question would be, what would be the full extent of clinical manifestation? Still not yet unknown. And then what are the therapies that we have in our pipeline to cover this? So for recoveries, we need our public health experts to come on board and do studies and follow-ups, because for now in Kenya, you just told you've recovered or go and do best therapy, and the story ends there. There's still no follow-up studies because we are the exponential phase of tackling this pandemic.
Yeah. Okay.
So it's still a gray.
It's still
a gray area.
Okay. Well, that aside, the handling and how we've treated our frontline workers has been a bone of contention for the longest of time as it stands right now. What more needs to be done to get from this point where, there are complaints to that point where we ensure that our health workers or the frontline workers are well catered for? Because in a huge way that will come in handy towards also addressing the issue of COVID-19 and the discrepancies that come along with them right here in the country.
Yeah, we feel for healthcare workers who actually up to this point are like our soldiers. And first of all, we want to salute them for the tremendous job. They're doing a good job. They've been there for us. They're covering the whole country and also protecting the world. So straight on point for healthcare workers, they have to be protected and given the right equipment and PPEs to protect themselves. The other thing is to withdraw vulnerable groups, and like breastfeeding mothers, frontline workers who are sick and have some condition, underlying condition. Get them to the back end. Yeah. Bring on board more healthy workers. Check on them. Have a complete system that protects them, even in terms of their career. Yeah. Get some motivation to the doctors so that they can work extra hours. So I think the underlying fact right now in the world is that we cannot cure the disease, but we can prevent it. So to protect the healthcare workers, we must give them the right PPEs, the protective equipment.
Okay. All right. Now let's delve a little bit deep, and we take a look at the clear picture right now that we say it's a trial and error at that point where everyone is figuring out. Do you foresee a scenario where now there's going to be high advanced levels of health systems and, and equipments and facilities post COVID-19 in the country? Is this going to transform the health sector in a way?
That's a very good question. And have to say that when you're dealing with the virus, we first of all think of how to control it, because as of now, we cannot treat the virus.
Yeah.
So when we talk about infrastructure, I would not be really keen on infrastructure for now.
Yeah.
Because if we look back in history, we've been a victim of our own success. By that I mean, when we talk in the past, when we had some viruses and TB in the past, TB, polio, and the diseases that we eliminated in the past, we somehow attenuated our own infrastructure. By attenuation, I mean we forgot about our systems to improve them. and it's now catching up with us. We thought it was bingo, we've eliminated quite a number of diseases, and here we are now presented with another universal problem. So COVID is a blessing in disguise, in that it's given us an opportunity to fix our infrastructure. You can even now find good ICU beds and systems in remote parts of the world and of this country. So we're going to see quite significant growth in infrastructure, but we need to work more on infrastructure that brings good turnaround time, not just heavy equipment, because you may have a small equipment or a small facility, but efficient. So we need to emphasize more on infrastructural efficiency for the Republic and into years to come.
Okay, well, and that aside, there have been reports of doctors or hospitals, being on the spot over handling of COVID-19 patients, and according to what it said, actually we have the latest story that was captured yesterday somewhere in Kisii, where there's been complaints that the doctors do not handle the patients in the right way, and if they do, then in a way they get to expose the people around them. What would you say about this?
Thanks for that question. I understand the situation in the country. Some of it I don't want to dive into because the buck stops with the Ministry of Health that can talk about that comfortably. But doctors are also human beings. Mm-hmm. They've been beaten. They've lost their colleagues in this fight. And they also have their own fears. So, because there's not much information about the virus, I still emphasize again, we are flying a plane and making it at the same time. Yeah, you're learning on the job. So we don't want to blame doctors entirely. Mm-hmm. But if the allegations are true, doctors have their code of conduct, ethical code of conduct, and they have to adhere to it strictly. Mm-hmm. Guidelines with the national, following the national guidelines. And it's about serving our patients. They're our frontline heroes. They're our frontline soldiers. If they lower their guard, the whole republic is in trouble. So at this point, we can say it would be unfortunate if it's true. We know they are stretched. The country is stretched in terms of resources, facility, but there's also fear of the unknown. That's mm-hmm. what we are dealing with currently.
All right, and speaking of which, again, on the very same tone, doctors being paid to give wrong reports on deaths of patients with COVID-19 to avoid unusual burials. Is that painting a picture of how much desperate doctors are and how much there's no money, so that they can go to that levels of violating, some of the rules actually that, one gets to learn at the level when they're studying, in school, so that they get to become doctors?
That's a ponderous box, I have to say. We can't treat it entirely as true, but if such things are happening in the background, then it's quite unfortunate. Uh-huh. So it also boils down to the kind of training we have currently. We need to have doctors who are also trained to go an extra mile to understand systems. Uh-huh. Not just trained from school and here you're working and handling patients. We need to have more institutions of learning, higher learning, uh-huh. and highly linked to the community to understand community, because you don't just want to go into community and start imposing your things or talking your things. And then also have doctors diving into research. We need to have research units within the training institute for doctors. Mm-hmm. So for money exchanging hands and things to do with doctors, I may not really be the best person in the country to talk about that. It would be unfortunate if it's happening, giving fake information. But we know as of now, at least the country is trying its best to give information, and we have to give the Ministry of Health a salute on that, on bringing out information to the public. Mm-hmm. But for doctors, we have to over-emphasize that they need support. They're also learning. They have their own fears, and we have to give them the right equipment so that they can protect us. There's no way you can fight a virus. This is a submicroscopic particle. It's not something you're going to see with your own eyes. You need to give them the right equipment so that they can fight effectively without retreating. But if their guard is lowered and they're not protected, humanly speaking, they will behave or they will conform to the situation that protects themselves, not the patient.
All right, lots of issues to do with corruption, yet there's still much that needs to be done in ensuring that we're able to handle this. You look at the system, you look at our facilities across the countries, indeed it is a wanting scenario, prompting the president to say that, all counties should actively be involved towards, first of all, ensuring that we're even able to get beds, 300 for every other county, that is the bed capacity for every other county. And when you look at this and you match up with the allegations of corruptions that are coming on board at this time when they have their donors who've come to, give us funds so we are able to deal with COVID-19, at this time when so much monies have been channeled towards dealing with COVID-19. I remember the other time the budget was read and almost all the monies were channeled towards dealing with COVID-19. Where does it place us, or what does it speak of this war and how successful we are likely to be?
Thank you very much. Corruption, I have to say, it's not only a Kenyan problem. It's a global disease, and my mom would always say we need to start teaching our kids from lower pre-primary about corruption as a unit to be taught. We've seen a number of allegations in the media, but that's the role of the government to swing into action and truly investigate the red flags that we are raising. If we get money from donors who are coming on board as health partners, we get donors in order to extend a subsidized price to the patient. Because if you look at the amount of money you require to do COVID tests, it's fairly expensive. Most people live below $1 a day, even in my home area in Muhoroni, where I come from, in the village. So you're not going to tell somebody to spend $150 to do a test.
Yeah.
They need $1 to survive in a day. So we shouldn't take or treat lightly any donor who comes on board to pump in their money, so that to reduce the cost of testing and treating the patient, it wavers a huge burden on the back of the government, and this is extended to the patient. So for counties and national government, if we're doing anything that's legal, I'm not saying they're doing it, then this is a virus, and it may truly catch up with you or your family member, and the ring is circular. No one is safe in this circle. That's what I can say. So we need people with integrity, a society with good accountability, and focus on the people and the people at heart. And also just running away from this current trend where every young person in the Republic wants to become a dollar millionaire overnight. We must, as young people and the future of this Republic, move away from this capitalist nature and try to work with what we have as we grow gradually. So corruption is going to end now, or in the near future. It's an old trade, but we believe at least the government is doing something and should be doing something about for prosperity.
All right. Doesn't it get you worried as a doctor, looking at the reports of the test discrepancies that we get every other day? And also these, complaints and allegations by people that maybe there's just something that the government is not telling us right.
From what I've seen in terms of test discrepancies, this is a virus. Matter in its genetic material.
Yeah.
So for viruses, we have hotspots within their genome. Genome is that whole set of genes that a virus has, which are called, they are highly evolutionarily conserved. These are evolutionarily conserved genes over billions of years, because the coronaviruses did not just come today. So these conserved regions are called markers, the identifiers. A marker would be something like someone is brown, someone is black, someone is tall. So these markers, scientifically, if you find the difference in tests is that some companies use up to 3 markers, some use 2 markers,
right?
And you may find that for another company, at the 3rd marker that they're using, there could be a mutation, because viruses, their business is to change the genetic material all the time and every second. So we find that the company with 3 markers picked up the virus. The diagnostic test kit using 2 markers did not pick out the virus because it misses the 3rd mark as expressed. So these are some of, just one of the variations that we're seeing in tests. But others are also negligent and non-adherence to a protocol and national guidelines. For example, if you bring in it into the country, the kit must be registered clearly, Pharmacy and Poisons Board, and taken through validation before it's tested. But we're in a rush. It's an opportunity to make money. Everyone is running around. Everyone wants to go into disease diagnostics and selling test kits. Even people who are in fashion industry, everyone has moved into disease diagnostics. So these are the gaps that we have, and that's why we are getting these varied results. Fast forward, the buck stops with the government. I saw it clearly on TV, a very big mistake. A private institution cannot lecture government institution on matter standards. So the government should take its position. I can say that was embarrassing, seeing
yeah.
institute lecturing government institution, big government institution like Cambridge on matters. That should not happen. The government should not allow private institute to quote unquote be the big person. They have to take charge and give us guidelines and say, we are working with this guideline, even if it's 80% efficient, or we are getting it at 90%, but it's the government standards, not from private to government, advising government.
All right. Well, interesting view right there. So looking at what I'd call is Sputnik V, that is the Russian vaccine that has come on board. Let's go back there briefly and maybe paint a picture of what it would take for, or the stages that a vaccine will take for us to be released, to be considered, legit. As we have seen so far, the likes of Germany have raised, concern on saying that there is no data on the quality and efficacy and also the safety of this virus presented to us by Russia. So when they raise such doubts, I think it's important then we go through the processes. And also from what the World Health Organization has said, we should not celebrate just yet. It's important that it goes through the processes. Like I started by saying, they are on the lookout for that, or they are taking charge on the same. So what are some of these stages that are required for it to hit to that point where it can even be disseminated to different countries?
Thank you very much for that question. The only underlying fact that we have is that we need a vaccine currently, and not just a vaccine. We need what we call early intervention for this. So we have to salute Russia for what they've done, but we also have to be cautious, because any innovation that would help us control this virus is novel. I want you to underscore that fact. And in science, we say a new innovation is an accident that meets a prepared mind, but it must meet some standards. The first one, it must be verifiable, and it must be, you have to be able to replicate it anywhere in the world, and you still get the same result. Vaccine development follows different stages. We have phase 1 trial, second, third, until you get to a stage where you're getting it to a human being. You use small models in between, then you get it to a human being. It's not something you can do overnight and say, bingo, here we now have a vaccine. And it must have global application. Remember, the human body is unique. We are quite different as Africans from the Caucasian and Asians. So if we are to come up with a global vaccine, I really don't want to get into global politics, because global business and politics, there's also something to do with global business behind a vaccine. And everyone is pulling towards their side and their technology and their patents and to big. Yeah, I hope you're understanding what I'm saying. But, well, getting back to basics, to have a good vaccine, we must think about what has happened over years. This is not the first pandemic that we've had. I want to tie it to the vaccine question that you just mentioned. It's not the first pandemic. If we look at the patterns in the last 18 years, in the year 2002, we had the SARS virus outbreak. It's within the coronavirus group.
Yeah.
In 2012, we had the MERS, the Middle East respiratory virus outbreak. And now in 2020, we have COVID-19. We have to think of early intervention of that unique cutting-edge technology that would help us bridge the gap of vaccine development, which normally takes a year or 2 years or even 10 years, with or without success, because at times it may not elicit the right immune response that we need. So what we are talking about is that we have to learn that which kind of viruses have been giving us problems. The coronavirus, we've seen through 2012 and now 2018. We must think of a universal technology that can help us rapidly develop a vaccine without necessarily going through what we call attenuation of a virus, making it inactive, the live virus, and getting it into the human body. We are in an era of big data, artificial intelligence, and advances in disease diagnostics. So if we have a technology that can bridge that gap to bring us a vaccine, an accurate vaccine, that covers the whole coronavirus family, because it's big, yeah? And we've seen the patterns with the years I've mentioned, we are able to prevent or protect ourselves from future outbreaks. That should come out clearly.
Right.
The other thing we need to turn to early intervention is therapies. Yeah, what kind of therapies are we looking at? Are we talking about antiviral therapies like the ARVs, monoclonal antibodies? People are currently using them.
Yeah.
We have plasma from patients who have recovered, and other antiviral therapies. So if we synchronize all these together and bring it on board, we are able to fight the virus effectively. But I can for sure tell you, because of global commercial interests, everything will pull to their side. But we have to sober up and do it for the patient. That is what we really need to do right now. So a vaccine is a possibility to prevent. I want you to underline that word.
Yeah.
To control and to prevent the spread of the virus. But I think we are able to treat this disease even in the next 2 years. Next year, not anywhere near next year or the years to come.
All right.
We are only able
to try. Okay, that's amazing. Dr. as we get to wind up, back to the scenario in the country. Extensively, the government is yet to hire more health workers, or to respond to COVID-19 after, since they advertised that was about 4 months ago. And the other day we had a report of, medical students who had cleared yet, then struck COVID-19, so maybe they had not gone through the process of clearing 101%. They're calling upon the government to incorporate them at this time to deal with COVID-19. Do you foresee a situation where the doctors in the country will be overwhelmed in the event that the government does not come in to address this?
Thank you very much for that question. And it's very important as we look straight into the screens and talk to the country. Young people need to get involved. We need more boots on the ground. That's the message that we have to pass clearly to the government. It's no longer a story like the first day 6 months ago when we were talking about COVID. I had a patient in Nairobi, and securing a bed space in Nairobi is almost impossible right now. You have to part with big money for ambulances to move from one facility to the other. And looking at the geographical coverage from Kenyatta University Hospital to Kenyatta Hospital to Mbagathi and other private hospitals, we need the trained young doctors, even on internship basis, to bring them on board so that we can run a 24-hour economy. They're already trained, and some of them can train on the job. As I've said, we are learning about this virus, so it's a learning experience for everyone. And not only doctors. Doctors are as good as the result from the diagnostic world. If you don't pick out and know what you're dealing with, then a doctor would just be doing a sweeping generalization. So we need to use young students who are done with their graduate studies or undergraduate studies from molecular disease diagnostics, biotechnology, biochemistry, who understand and have been attached in core facilities like Cambridge and are well trained. We need to incorporate them into the system, even on a voluntary basis. So many of them are willing to volunteer. We push testing to a 24-hour system, have more manpower, and reduce turnaround time. So you would see a clear picture in the country about testing and what we are dealing with, the two pictures. These advises doctors.
Okay.
In short, diagnostics advises treatment. So I agree with you totally. We must involve the young doctors who maybe are just on the street.
Okay, thank you.
Yes.
Thank you so much, Dr. Samuel Omolu, for the great insights. This is a conversation that is ongoing based on the situation that the global fraternity is dealing with matters COVID-19. As we get to wind up, Dr. Ari, in 30 seconds, anything that you'd want to say, or we wind it up there? Dr. Ari?
Mine is to ask everyone, we have to protect ourselves at all times. Don't do it for the police. Don't do it for the authorities. But this is personal responsibility. We are not going to control this virus, which is the right time, by just taking everything lightly. We need to engage the community more and understand them, and make the community understand much more about what the extent of what we are dealing with. We need to start talking about vaccination, possibility of vaccination, have community getting involved, so that by the time we get a vaccine like the Russian vaccine, we are not caught flat-footed. We need to involve the community more. We also need to invest much more on cutting-edge technology, like isothermal PCR, reducing turnaround time in testing. We also need to reduce taxes on diagnostic companies that bring kits into the country so that we have good turnaround time. We must finally call and rally all our research institutes to develop their own local assays. By assay, I mean local testing solutions to reduce the cost test extended to the patient. And with that together, we'll be able to fight off the virus comfortably. We also need to understand and map out communities that are hard affected, like the slums. Look at the prevalence, look at the incidences, and look at the comorbidities like diabetes, HIV, obesity, and what can really get people to an extent of chronic disease and to death. And personal responsibility, let's not use COVID as a capitalist creating behavior, but as a unit to serve the world and to give our story years to come on how we handle this current pandemic vis-a-vis what we saw and judge the community that handled the 1918 flu pandemic, Spanish flu pandemic.
All right.
Thank you very much.
Thank you so much, Dr. We're looking forward to have you some other time as we expound some more on matters of health. And on that note, we wind up this conversation as we cross over to a different one altogether after this short break.
Thank you very much.